Hi everyone, welcome back to another episode of Be a Nurse They Said. My name is Lainey and I'm so happy that you're here. If this is your first time joining me, make sure to check out my first video where I talk about myself a little bit and my background and what this channel is all going to be about. Last week, I talked about tips and advice for the nursing student who is about to graduate and take your NCLEX. So if you didn't get a chance to check out that video, I will post the link here in the video so you can take a look at that. If you're a nurse educator, you can share it with your students, or if you're a nursing student yourself, you can take a look at that and get some tips and advice on taking your NCLEX, which is going to happen really soon. This week, I'm going to talk about tips and advice for the graduate nurse who is about to start their career. So this can be an extremely scary time. You're starting a new role with new people if you don't know them from before, possibly in a new place if you've moved or you're changing locations in the hospital or institution that you work at. This can be very overwhelming when you're just starting out. This is a lot of change to handle at one time, so it's important to take a couple deep breaths. We're always going to come back to taking deep breaths and really hone in on your practice and the kind of nurse that you want to be. So there's some things that you can do to help, and I'm going to tell you a few of those tips. Right. So you passed your NCLEX. Amazing. Now what? Now you get to start practicing as a nurse. You have worked endlessly and tirelessly for this moment, and you should be extremely proud of yourself. So I first want to take a moment to say congratulations. You did it. You're here. Now let's get to the good part. So my first tip, if you're working on a specialty floor, I suggest that you take a look maybe back at your notes, but also at skills and tasks that are going to be specific to that floor. For example, if you're going to start out on a urology unit like I did, it might be a good idea to look at your inserting indwelling catheters and doing straight catheters. You are probably going to see a lot of that on a urology floor, so it's probably a good idea that you review that skill. If you're going to be working on some sort of cardiac floor, you probably want to take a look at your EKG and telemetry notes because all of your patients are going to be on telemetry. You may also want to look back at things like heart failure and CAD to look at those protocols and what the care for those patients look like. If you're on an ortho floor, maybe a trauma floor, you may want to take a look at the different types of traction that your patients may be in, the different types of braces that they may be in, and how to care for those as a nurse. And if you're going to be working on an oncology floor, you may want to take a look at the different precautions when they come in, specifically the neutropenic precautions, just because these patients are very high risk and immunosuppressed, and you want to be sure that you're doing everything you can not to make them more sick or bring in other illnesses to them since they are so susceptible. Now, I'm not saying that you shouldn't have a basic overview of a lot of different things and skills and tasks and knowledge that you learned in nursing school. You should, but when you're going to be working on a unit specific to something, it may be a good idea to look at things that you're going to see a lot when you're working, so you don't have to look them up while you're working. You go in with a base knowledge of them. My second piece of advice is to make sure that you connect with your preceptor. You are going to be with this person for probably a minimum of 8 weeks, but more so 12. If you're going into a higher level of care like the emergency room or an ICU kind of floor, you're going to be on orientation for a little while longer than a regular med-surg floor. But it's really important that you're going to connect with your preceptor and get along because you're going to spend a lot of time with them. You're going to be learning a lot from them, and you want to feel comfortable going to them and asking questions or getting clarification on things or just looking for help with things because it is about your learning. You want to be the best nurse that you can possibly be. So if you're with someone that you don't feel comfortable asking questions to, it may not benefit you in the long run. So I will say that it is okay to ask for a different preceptor. If you're having trouble with the person that you're originally assigned to, don't be afraid to go to your manager and just say, hey, this just is not working for me. We're not clicking, and I feel like it's affecting the care of my patients. Could I be paired with somebody else? And 9 times out of 10, they're going to be more than happy to switch you to someone else that may be a better fit for you. My third piece of advice is to ask questions. There are never too many questions. I still, to this day, when I pick up on the unit, ask questions because I want to make sure that I'm delivering the best possible nursing care to my patients possible. And I'm not there all the time to know all the little changes that are happening. So it is so important to ask as many questions as you have. The questions that you don't ask are the ones that's going to end up hurting your patients because you may not be sure of something and just go with it anyways. So it's important to ask those questions because if you don't and something happens to your patient, that's going to fall back on you, and you don't want that. Even if you feel a little confident in a skill or a task or doing something, just have your preceptor come with you into the room just to get clarification. It's okay. You're learning. This is very important for your learning that you ask for help, because the more that you know, the better care you'll be able to provide. My next piece of advice is to not come off orientation too early. Even if you are feeling super confident in your knowledge, in your skills, in your task, you're taking a full assignment, don't come off orientation before your scheduled time to come off, because you should really be using that time to learn as much as you can and ask questions, because once you're off of orientation, you will be a little more on your own. Now, there will always be someone there to help you, whether it's another nurse, whether it's your unit charge nurse, the nursing house supervisor, anyone else. There is always someone there to help you. However, you should take all that time you have on orientation to learn as much as you can from your preceptor, because they're assigned to you. They're going to be with you. They are kind of your buddy for 8 to 12 weeks, however long you're on orientation. And you should really use them to your advantage to learn as much as you can to care for your patients. Not only don't request to come off orientation too early, but don't let anybody take you off of orientation too early. If you've worked at the hospital before you were a nurse and you're moving into a different role, then they may think that you are ready, just say before 8 weeks, to come off of orientation, because you know the hospital, you know the charting system, whatever it may be, but you're learning a completely new role. It is a completely different idea to be acting as the nurse than acting as, just say, the nurse's aide. So it's important that you don't let them take you off of orientation before you think you're ready to come off of orientation. Not saying that you're not doing a fantastic job, but like I said before, just take all that time that you can to learn everything you can from your preceptor and ask questions and really get comfortable. Now, it is okay as well to ask for a longer orientation. If you get to week 12 and don't feel as comfortable as you would like to and feel that you need a little longer of an orientation, it is also okay to ask your manager to have a couple extra weeks of orientation. That's only going to benefit you, the floor, and your patients in the long run. So you have to do whatever you feel is best for you and your learning. My next piece of advice is to not pick up overtime too early. Now, I know the money looks great. You're going to be making great money as a nurse, and picking up that overtime, you may be making double, triple time, depending on what kind of incentives that your hospital or institution is offering. But you really want to make sure that you're comfortable in your role as a nurse before you're committing to any extra work. There will be plenty of time and plenty of shifts to pick up after you are more settled in your role. They are always in need of help. The overtime is not going to go away. So once you are a little more acclimated to wherever you're going to be working, then it will not be a bad idea to pick up overtime if you so choose to. My next piece of advice is to take your lunch break. I know it sounds very, very simple, but there are so many times you get caught up in the day or something that you're doing for your patients or helping your fellow nurses that you don't have time to take a lunch break. But I promise you, you will look forward to those lunch breaks. It'll be 5 hours before you realize you didn't even go to the bathroom yet or had a sip of water. So please, please, please take your lunch breaks. 12-hour shifts, if that's what you're going to be working, can be extremely difficult, especially if you're on your feet almost the entire day. You're exhausted. So taking that lunch break really gives you time to sit down, refresh, recharge your brain, and go out and give the best patient care that you can. Because if you don't take a break and you don't sit down and recharge your brain for a little bit, you're going to be tired. There's a better chance that you could make a mistake, which could really negatively affect your patients, and you don't want that to happen. And when I say take your lunch break, I don't mean heat up your food and eat it at the nurse's station while you chart. Actually, physically leave the unit, go to the locker room, the break room, wherever your institution has you take your breaks. Put yourself on do not disturb if you have any sort of phone that they can get a hold of you, and actually take your 30, 45-minute break, whatever they give you, and reset, recharge, eat, and get away from the unit and the nurse's desk. That way you don't get interrupted. My final piece of advice for you graduate nurses who are about to start your nursing career is to make a to-do list or a checklist for your shift that you're working. I still do this to this day. I've done it since I started 8 years ago. I always make a list of what I need to do for the shift, or I will forget. What I do is write down all the patient rooms that I'm assigned to, And then as I chart their assessments, I will put a check mark. So I know that my charting is complete for that patient. And then when I chart my nursing care plan, however your institution has you do that, I totally cross it off so I know that my charting on that patient is completely done. On my to-do list, I also write down if they have any sort of IV fluids running, any drains such as JPs or Foleys, chest tubes, whatever it may be. I write down if they have any specimen collections due, whether it be from a port, so they have blood samples, or they need a urine or a stool sample. I write all of that down that I need to do for the shift. That way, one, I remember to chart on those IV fluids and document those I's and O's, chart on those drains to show how much I got out for my shift. And whenever I complete it, I cross it off. That way I know that I did it and I know that it's done for that patient and my shift, and all the I's and O's are completely up to date. So to recap, a couple things you should do when you start as a nurse. Review anything that may be specific to your unit, any sort of skills, knowledge, tasks that you think you're going to be doing frequently on a day-to-day basis when you work. Make sure you connect with your preceptor. Ask for a new preceptor if you feel like you're not clicking with yours because you want to promote the best learning for yourself that you can. My next tip, that includes asking questions. Keep asking questions even after you're off of orientation. Never stop asking questions. Never stop learning, because you will learn something new every day that you work. Don't come off orientation too early. It is okay to ask for an extended orientation if you feel like you need one. Wait to pick up overtime until you're a little more acclimated to your new role as a nurse. Make sure that you take your lunch breaks, take them off the unit, don't eat at the nurse's station, and then keep a to-do list or a checklist for your shift when you go into work. This can be super helpful to make sure that you keep yourself on track. This will help you with your time management and keeping up with things you need to do while you're working. After all that, I want to thank you so much for joining this next episode of Be a Nurse They Said. Please be sure to like and comment on this video, subscribe to my channel so you can see when I have all new videos coming out. Be sure to also check out and follow my Instagram account, Be a Nurse They Said. On there, I post updates on when videos will be coming out and different things about my channel. And remember, don't just be a nurse, be amazing like I know you all are. I'll see you next time.